Gotta be up
No,
close.
gotta get on the couch here.
Yep.
All right, you ready, Damien?
Here's two coaches.
Oh boy.
Wow, there's 3 people who can see the screen and they can answer all the questions then. Yay! All right,
It wasn't
so,
so hard to get up, I believe.
so training tonight is on Up Your Nose with a Rubber Hose. Anybody know what TV show that's from? Oh, welcome back, Hunter.
Welcome back, Connor.
Thank you. Okay, so some people do know. Or it's just a plain review of some airway management skills. Okay, so when you get that call, difficulty breathing, shortness of breath, choking, not breathing, what are you going to do? What's the first thing that is going through your mind? What are you preparing for? Are you thinking, oh, it's just going to be exactly what dispatch is telling me? Or are you kind of thinking in advance like, oh, it could be this, it could be this? What kind of bags am I going to take in? What kind of equipment am I going to be thinking about? Are we piling everything on the cot and taking it in right away, or are we running in with our blue bag? So things like that. And then always in the back of your mind, what are your protocols? So making sure that you review your protocols, you know what you can and can't do, because protocols matter.
Yeah,
Protocols
what's
matter,
that
guys,
number?
come on.
31337.
So here's the little plug to, if you're unfamiliar with like what our protocols actually read for airway management and things, it's always a great thing to go back and review because we can all use the review. All right, so your priorities. So do your priorities change based on the type of patient that you're getting? So if it's an adult patient, are you going to be concerned about something that you wouldn't be concerned about with kids? This is a yes or no question.
Yes, yes.
Yeah. And what would be some concerns? So what would be a concern for an adult patient that you might not have with a kid?
Overdose.
Yeah. Yes, yeah, it could be. What about a pediatric patient? What are you thinking about with them? Choking. And what is the most common for a pediatric patient, choking wise? What do they have in their mouth that's really, really big?
A ton.
Their tongue. Yep. So adults and elderly patients, what kind of medical conditions are you thinking about that could be causing what's going on, especially like your shortness of breath or difficulty breathing? Are you like, it's a little hot outside, maybe it's just the humidity? Or are you thinking, could be stroke, it could be a heart attack, it could be, there's a myriad of other things. So then, what types of equipment do you have that are going to be helping this patient, especially when we have multiple bags and other equipment that we have to grab? Like, you have to remember to grab the suction, and you have to remember to grab your monitor when you go in. It's not just, okay, I'm going to grab the one bag and we're good to go. You got to be thinking of what else you might need. And remember, don't get so focused on the patient or what dispatch is telling you. Sometimes less is best, and treat your patient, not the monitor. All right, so what types of advanced airways do we use here? Can anybody name the 1, 2, 3, 4, 5, 6 things that I listed?
ET,
Okay,
King,
yes,
Crike,
yes.
nasal, oral,
What's the last one? There you go. And I had to put combi tube on there because most of us did do the training for combi tube still. And there are a few of them floating around. And the motto of EMS is improvise, adapt, and overcome. All right, so PACE methodology. I did not know about this until Miss Emma told me about it. So you have your primary, alternative, contingency, and emergency plan. Believe it or not, we do all of this. I just never heard it as the acronym. So your primary is the plan A of the situation. The ideal outcome for this situation that is dependent on the provider level. So as an EMT basic, yours might be different than the paramedic, and the paramedics might be different than the advanced, because there's all different skills that we can do. So ALS, first pass success rate of a ET2, or with BLS, suction and BVM ventilation, and then depending on trauma patient, doing your jaw thrust or the head tilt chin lift. So your alternative plan. So plan A didn't work. You didn't get that ET tube right away. What are you going to do next? Do you have it planned ahead of time? Okay, well, I'm planning on getting ET tube, but if I don't, do I have something set up for? But we don't panic because we prepared for this. So the key is to change something, but not everything. We do not try the same thing over and over again, like, no, it's gotta work, it's gotta work. You can't really shove the ET tube in there any farther because you might damage more things. It doesn't really work. So if you're ALS, reducing your ET tube size, change between direct, use your bougie, reposition patient. Do you need to pad up their shoulders a little bit more? Do you need to take away padding? Do you need to try and position them a little bit better? Or your BLS, so you tried an OPA, well, it's not working. Okay, try an NPA. Try bagging them a little differently. Grab another person and have them hold the seal while you bag. Just maybe little tweaks to try and make this a little easier. So your contingency plan. All right, A and B have failed. Now what do we do? And for ALS and BLS, that's a non-visualized airway, so like putting in a king or a combi. You have the LMAs or the iGels, depending on what services you work for. And then you have emergency. You've tried everything else, it's not working. All right, well, we can't intubate this patient. We can't get a tube in there. We can't get a king in there. What are we gonna do next?
Spend some dollars.
That's your other option. Or you can pull out that crate kit. I've had one call where I started thinking about the crate kit. Thank God I didn't have to use it, because that is like the one skill that I'm absolutely terrified to do. We've trained on it, I know how to do it, I can probably do it in my sleep, but I absolutely don't want to do it. Alright, so your BLS airway management example, so make sure you do a complete assessment of the patient's airway. Are they breathing? Is it patent? Do we have an obstruction? Is it going to be a complicated airway, like you're thinking like your Lemon and your Mallampati score? So your primary is suction BVM. Okay, we can get oxygen moving, we can get things going. Then your alternative, all right, let's put in an OPA, NPA, or using BVM still. King as your contingency and emergency, like we need to go now. We're calling a helicopter, we're getting them loaded up, we're calling an intercept if we're the advanced crew, things like that. And it changes depending on if you're a paramedic, if you're an AEMT, or if you're an EMT taking this call. So some pearls of wisdom. So plans can change dependent on patient assessment because every patient is not the same. And just because you have one difficulty breathing patient, are you going to have the same one? And is it going to turn out the same? No, it's not. And it depends on what your level is and how comfortable are you with that skill. There are some people that are really, really good on bag valve mask. They do an excellent job of bagging the patient. And there's some people that don't. PACE can be applied to almost any situation. And the most important part of the PACE plan is that you have one. This plan allows you to quickly anticipate problems and react to those problems as they arise. Look 5 minutes into the future, anticipate problems, and be ready to react. Have everything out on the table ready to go. When you're setting up, because you're going to be intubating this patient, make sure you have your king as your backup. These are things that you can have an EMT do, you can have a first responder do, helping the medic. But as an EMT, you know all these skills, you know what the medic's going to need for this. You can be looking at the patient going, well, I think they're going to go for this, but if it's not going to work, what can I do to help them get ready and anticipate problems arising? At the end of the day, we need to manage the airway. Any means of managing the airway to oxygenation is successful airway management. Remember, even if the only thing you can do is bag this patient, you're managing the airway. If you can't put a tube in and you're still bagging them and you're getting good oxygenation, that's the goal. That's what we want to be doing. All right, so let's do a couple scenarios. So you arrive on scene to find a 68-year-old male sitting in the tripod position on a kitchen chair. You've been called for difficulty breathing, so that's kind of in the back of your head. He's pale, cool, diaphoretic, and you can hear him working hard to breathe. You can see some accessory muscle use. Your patient does not acknowledge your presence when you walk into the room. He doesn't answer any questions when you talk to him. He has a weak, rapid pulse and a respiration rate of greater than 30. So what are you thinking? Is this a sick or not sick patient? Sick. Are you going, yeah, we got time to play, or we need to go? So what types of airways would you be thinking on this patient?
Does he follow
because he's not acknowledging when you're there. Just imagine your really difficult breathing patient that their only focus is, I just need to get my lungs working and breathe. They don't listen to you when you're talking to them, they're not acknowledging. You could be thinking of BVM. This was an actual call that we had, and we tried CPAP. And the patient went from kind of sort of breathing to not breathing at all. He was so clenched, I could not get an OPA in him. I think we did an NPA and then bagged him to the hospital. And then they RSI'd once we got there. So make sure that you have your options. You're thinking of what you could be doing with this patient. And if one thing doesn't work, you have other options. Don't panic, because the moment you start panicking and start freaking out and getting nervous, you're going to start making mistakes. Things are going to take forever. You'll drop things. Make sure that you always take a breath. Make sure that you're calm. It's not your emergency. You're there to help. Relax and just do the next step. All right, so scenario 2. So you have a 30-year-old male patient found unresponsive in his apartment, not breathing, no pulse. Vomited his airway. It's a suspected drug overdose. So we're not getting into CPR or anything. We're just still focusing on the airway. So what type of airway are you going to use?
Suction.
Suction. And what happens when it's very, very chunky and you can't get it out with a regular yank hour? What are you going to do? Yeah. They tell you not to blind finger sweep, but you got to do what you can to get it out of there.
I don't think that's the right correct answer.
So scenario 3. So a 35-year-old female choking on a grape. You arrive on scene to find her becoming unresponsive. The Heimlich was unsuccessful by family that watched her choke. PD that arrived on scene. Fire department that arrived on scene after you, and you walk into the house. You can still kind of hear her gasping for breath, but they're now taking her from a sitting position where they were trying the Heimlich to laying flat.
Look for a grape.
Now what are you thinking?
Yell, chew your food, chew your food.
Throat punch third.
So this patient, after the emergency was done, found out that she had a type of neurocancer. So she was losing like her ability to swallow and process her own food. Family failed to cut up a grape that was probably about that big, and it was stuck right in the back of her airway. Family had tried to do the Heimlich, because this has happened a couple times before. PD tried, fire tried. By the time I got there, grape was still in there, and she was barely breathing. They're like, okay, well, somebody's going to be starting CPR, or we're going to have to do something. I sent my partner out for the auto pulse, because we're going to have to do that. And just thought of using the McGill forceps and seeing if I could see the grape. So as she's still gasping for breath, every time she gasped, you could see the grape for like a split second, and then it would suck back into her airway. I was able to get it out with the McGill forceps. Probably took about 30 seconds, but it felt like the longest 10 minutes of my life. And then she was breathing just fine. But in the back of my mind, I'm going, okay, well, if we can't get this grape out by this way, we're going to be doing compressions to try and maybe get it out, looking for that grape. We're going to have to go send someone back out for the crate kit, because we're going to have to use that. It was, like I said, that's one of like my scariest calls. And after that, like, okay.
So was it far enough that you could see it? Why couldn't you roll her over? It wouldn't come out? Or?
It was completely stuck in her airway because it was so big.
Okay,
it
so
was-
every time, so when
Yeah.
she gasped, just because she
Yep.
opened her mouth, you
Yep.
could see it?
Yep.
Gotcha.
Mm-hmm. So, those are some calls where, yes, it could be very simple, but make sure that you have a backup plan, you have other options, if you never know when it can go south. All right, any questions, comments, concerns, or story time? Because you can share a story if you have one. There was this time where I had this call, and it was gonna go like this, and we had these problems, but we figured it out and did this instead.
There's a heck of a lot of blood
My
when you
kid
crank
choked the
something.
other day. I don't know, mine shaft, everyone else was freaking out.
You just
That
sat
was
there?
fine.
Like, I'm not.
Everybody else is like, she's choking. I said, I got it, chill out.
I
Well,
got
I
it.
slept, she was good to go. Everybody's standing around freaking out. I was like, another day, let's keep going.
Then you want the back?
What the? I was like, next time, chew your food. But everybody was staring at me at that point in time. I was like, it's fine, fine. I had like 3 waitresses around me. Do we need to call anyone? No.
Did you say I am
My burger's not done yet.
All right. And so, in this day and age, I'm sure everybody has their phones with them.
We're doing a Kahoot.
We're doing a
Oh,
Yeah.
here we go.
What's the link
I don't know
here?
why we
Back
don't,
on.
I don't know why we don't use like the big monitor, like, people.
Oh,
I don't
it's
know.
not sharing.
I don't know, I'm gonna have to watch the, I gotta watch you, Laura.
I don't know why.
Look at
we don't-
Betty up there.
So what do you gotta do?
You have to have a login now?
No,
No.
just to play.
Oh.
How do I share my? Never mind. Nope. It's not doing it.
Those three things to add on to it.
How do I share my internet screen? For it
What
to
do you-
come up.
Just drag it over. It must be left or right.
Yeah, there it
I
is.
gotta come up with
Okay.
What do you, wait, how do you do
Stay away
this?
from
I've
me,
never
Beth.
done this, Rebecca.
You just don't want to be trying
Let me,
3, 5.
is that a B or an H?
Read off the, where we're supposed to go.
All
So
right,
you have to go to
www.
www.kahoot.it.
It didn't work.
Go. Racer.
That pin isn't working.
Game pin.
I'm gonna guess
Okay.
that's a 2, 4,
Hold
4.
Oh, because I'm on.
It doesn't work. Yeah, it doesn't work.
Garbage.
Hey, Damien, what number should we use? 3?
31337.
Thank you.
Okay,
so game pin, what's the game pin?
It's reloading.
31337. Go right here.
Adam's over here.
What's, oh, wait, 40, hold on, 40,
9,
9.
3, okay, 5, 1.
I've never played this, so let's,
Alright.
what's a nickname? Now we're gonna have a nickname right
What was yours? Yours was Smiley.
Oh,
yeah.
smiling.
Oh, look at, just look at that, I'm in there.
Oh, we're using medic names? Okay.
409 2351.
I thought that was an advertisement.
If they're not naked and
Big
small, it
shoots.
doesn't know what to look at.
Smile like. I should have used my normal name.
So when we were all in medic school together, we would do a lot of Kahoot quizzes for medic class. So Ike's nickname was always Smiling Ike. All right, is everybody in?
Adam too.
You gotta put a name in, Tart. Nickname, you.
Tart.
There you go.
Hey,
Tart,
you
tart.
Tart.
Now hit.
Josh, I don't see you in here.
No?
Josh is
Yeah.
right there.
Josh is in
I
there.
was looking at the top row.
Where'd you go?
Cool kids are on the bottom.
Focus ants.
Where did you go? Focus what?
Mine's not
Focus
on there.
ants.
I can't see it. I don't know what it says.
And 68.
That is
Somebody just
not
used his
me.
name.
Adam, did you put your name in there yet?
No.
Are you on someone else's
Did you
game?
get your name
Don't
on
play
there?
with me.
There's an
There's an Adam.
We're gonna be interviewing as a team today.
Did you see what I typed?
Yeah.
Isn't that what I typed?
How I got there?
I'll go with it.
All right, is everybody in? Are we ready to
It's the
go?
same thing, you just
Okay.
cross up on
I don't know if we can pass this part.
We're done.
it. Okay, here we go, here we go.
Focus.
Internet crashes.
How am I supposed to read that?
What percentage of oxygen is delivered when a nasal cannula is set between 1 and 6 liters per minute?
Oh, God. We can't.
I can't.
You gotta.
10 to 8.
Oh, it's up there, okay.
Are you running out of time? I'm just gonna go green.
You have 15 seconds.
Yeah, well, we can't read it from back there,
Sorry.
so.
What did you pick?
What percentage of oxygen delivered when a nasal cannula is
I don't know this.
24 to 44,
5 seconds. How many questions are, 20.
20 of them.
Oh, it timed out. Time's up. Shoot.
Okay, get ready for the
Yeah,
second.
correct.
Damn, not off to a good start.
Yeah!
196 points behind Josh. That should be a little bit better.
I have an
Okay.
answer streak of number 1.
I'm tied with Ann.
Oh, Adam's been
I got
so
timed
far.
out. I had to think too long.
Because I got the wrong answer.
Hey,
Oh.
now.
Not what? What is this? Oh, I can't read the
I'm
last one.
trying.
Faster than a person's.
Oh, wait a minute.
What was the question? Because now I can't read it again.
What's true about respiratory rate?
Oh, they gave you more time this one.
They probably can
Yes.
sense how much we're struggling.
Right. If we all just keep pushing the wrong answer, maybe they'll like give us something really easy.
They're gonna be like, all right, we're just gonna.
Alright, cool, Ryan.
Hey, you don't got it right.
I bet you guys really wished you were on the couch right now.
Okay, let's try this. Adam's still in the lead.
How come you
Damn
didn't
you, Ed.
answer the same questions right?
Yeah.
How are you
But he did it faster.
I can't read that fast. I have a reading ability to get the 2.
Don't give yourself credit.
I keep looking at my phone thinking the wording is
I know,
up there.
like the games we play.
So I would bet I answered
In
fast
abdomen
enough.
breathing.
Huh.
I lost my.
How are you reading this?
What's that picture?
It's from Rugrats. Yeah, that's Cynthia. I don't remember.
Two screens together so that they match each other.
I can see him fine.
Not.
I'm 26 points behind Smiling Ike.
Moving up in the world.
Skylar's on fire.
Put them out. Put them
Heating
out.
up.
I don't know why I'm not moving up. I'm getting them right.
I know, me too.
What's the winner? Hey.
Bragging rights. Now is the
Crisp
first
high
phone
five.
shut off, I answered a question. I don't know what I get right.
Red.
Dust yourself off.
That's correct on my phone, so I'm recording that.
Damn it.
Back and
Oh, you're
forth.
backing up. Son of a bitch. I can't read that fast. Oh. Pricks, can't read that fast.
I feel like
Oh, I'm gonna retract my answer.
me too.
Nope.
You can't.
I hope you didn't make
I
it.
should
I
not
didn't.
get so fast. I think that's something.
Forward.
Oh, no. it
You're right.
could be. Oh, it's good.
How do I get down there?
Why am I losing?
I didn't get through the question.
It's up at the top.
Oh.
I didn't get to read this whole time. He hasn't noticed. We're 6 questions in, Evan.
I didn't see. I went, I said 10, I don't know.
The other day I
So
drove without my
whoever
contacts.
loses
That was
loses
fun.
their license. Take the
That
test.
was dangerous.
I think I'm gonna brush
Alright, well,
up on
don't
your
trust
way.
that Bethany was suctioning an adult.
Whoa.
Whoa, Skylar.
Oh, oh.
Looks like Evan Reed.
Reconnect.
Good job, guys.
Well, that's.
Not even on the thing anymore. Might as well just give up and go home.
The tip of the what?
Tip of the nose to the earlobe.
Oh.
Trick question.
All those pricks. Come on, Bob.
I think there's gonna be an even split.
I was trying to read fast, and I'm skipping words.
Yeah.
Son of a bitch.
Hey,
Clearly, EMS
Alright,
stuck.
Brandon, that one correct.
trying to read fast.
So
and
clearly, you
quick.
guys, yeah, we can't read, so that's okay.
No.
Old Beth.
With all his blanks.
Son of a bitch, my phone went to sleep.
No!
Yes.
There is. It's catchy.
There we go. I'm in 8th place, it says.
We're 300 points behind Laura Burge.
Keep your phone away. Mine went to sleep.
He tells people how people answer.
What is the tongue difference? Is it kind of like?
Give me
Well,
that
if you're
tongue.
on whatever Chicago show that was, they hooked the
Yeah, that's right. And then
Yeah.
just fishing hook pulled it right out.
Oh god.
Sorry.
I answered slow, so I'm not gonna do it.
I don't know that.
but everyone answers slow. So
Like a little Mission Impossible going on. Oh, I'm moving up. 6th place now.
Just pass me, Evan.
Mr. Oh, I
Coming
answered
for you,
slow. I'm not
Skylar.
gonna give you points.
of most. Oh.
Wow, there was a.
And I missed
Oh,
the
shoot, I hit the
zero.
wrong one.
Did you? Did you? Yeah! Yes! I'm moving up!
We're so far ahead of you.
All
it don't
those
matter.
years of cascading bottles right there.
Yeah, no shit.
No, I had the right one. There's a zero missing.
Yeah.
Saw two
So
zeros.
it's not the right one.
No,
Is what
it's
you're
not.
saying.
But
It was the
it's
right
not
one.
like it's
in my
like
head.
500.
All right.
You were, yeah.
Ooh, Verge, we're moving up now. 9.
Shit, I didn't register.
Damn, I'm still 6th place.
It changed.
Never gonna get up.
Oh, no, we're not gonna
Adam's
even, we're
coming
not
up,
even
though.
in competition, Carol.
I'm guessing.
Me too.
I think I may have hit the wrong one.
I me too.
Yeah.
Oh,
No.
I got it. Oh, I thought it was up higher myself, and I got kind of
Oh,
worried.
that, yeah.
So, for anybody who hasn't seen an eye gel, you don't have to inflate. You basically just shove it in.
L maze you have to play.
Yes.
Look at, watch it, watch it. There I am.
Okay.
Back on the
Oh,
board.
he's actually on the screen. About time.
I get that.
What is that thing?
It's not
like
selecting
my
it.
home button. When I hit that,
Bagel
it shuts
maneuver.
me off. Hit it and shut off.
I'm getting the hang of this game now.
I'll have to stop stepping in front of me.
Why'd
yeah,
you
blame
pick
it
to
on
stand
her.
there?
He's not even standing up. He's
Is that like a
6'5".
last
All I
question
have
where
to
you
do is
bet all
stand
your
there.
points?
Bet all your points.
Does this hurt?
What time is lunch? That is always the question.
It's a
If
valid option.
blue's
It is
not
like-
the correct
I'm
answer,
going blue.
I'm out. Yep.
Oh, right. Oh,
Well, you can pick two?
wow.
Some of these might have multiple choice.
But when I pick one, it always goes away.
right? You can't
You
pick
can-
both.
Oh,
Yeah.
oh, I got worried.
There's 2 correct answers. God,
I never played this game before.
this is basically all medic school was.
Pretty much.
Well,
That's
back in
how we
my late
learned.
school days. I could see everything.
Someone stand in front of the TV and see how well you can see it.
Oh, my goodness.
Ooh.
Who's measuring the bag to see if it's fully deflating to 1/3? I usually squeeze it.
You
Just
don't?
Guesstimate.
squeeze it.
Man. Get over here, Joe. If your mandible is facing your septum, there is an issue there.
Good job, guys. Oh, Skylar's still in first place.
At the top of the page.
What's up with
I
that
just
picture?
that one.
I'm trying to figure it out.
They swapped face swap.
Probably the distract.
That's what I think.
Oh!
Oh, come on. Nailed it.
It was half and half.
Sorry.
That was unconscious.
Whoa, second place!
Two more questions.
Not by much though.
Oh.
Souls of your enemies. Yes.
I mean, technically, oxygen is correct.
Because I don't want to.
True. Maybe it's a twofer.
Because if oil comes out,
You are
different
in
thing.
trouble.
Different thing.
Wrong tag.
I'm coming after old Beth right now.
Mandatory. I think those three people should get credit. Oh, Smiley.
You need to answer this one wrong, Beth.
Come on, old Beth, fuck
Shut
it
your
up.
phone off.
Which partner are we talking about? Like husband,
Let's just,
EMS partner.
just pick me and. There's no wrong answer.
Mine's not selecting anything. That's bullshit.
Haha, I plead the fifth.
Me too!
All right. Who won?
Oh, there's a right answer.
Live to fight another day.
Second place is bullshit.
Oh,
Congratulations,
There
Skylar.
you go. Have fun. Uh-oh, who's it?
cheater. Cheater.
Sure you know how to play this game.
Yes, I did.
She had the answers ahead of time.
Good job.
What did we have? Doesn't
Not
it-
that much.
Doesn't it list the whole order so we know how?
I bel-
No, we don't wanna know the
Right
bottom
after.
half.
I'm pretty sure it says on your phone.
Well, we answered some that was. Oh, here, we got, okay, this is.
Oh,
I
yeah.
declare a rematch.
Yeah, okay, well, that's our number, we don't need to show it.
I got a couple right.
Yeah. That was kind of a fun game.
Yeah.
Okay.
Hey, we got a 72. That's passing.
What's passing?
That's like-
Didn't finish in what grade?
You just don't. That's a C minus.
Oh, that was fun.
See? I told you my phone wasn't taking the answer.
Yeah, blame it on the phone. You can blame it, but I can't blame it on my eyes.
I just couldn't see from back
All right, and there's your airway training.
That was very good, Rebecca.
I like that.
Very good. Thank you.
Once I figure out.
Nailed it.
Yeah. Play it for
See, who's the wrong?
I really bad trivia. Really bad.
Oh, gosh.
I
Yeah,
still have
I'm
my
not
account
quick
for
on
like
those
paramedic
trading cards.
school, and so my practice.
We didn't remember, we just
All
have a short
that's been
meeting.
recorded.
I swear to
We
God,
just
I
have a
woke up in
Let's
medical
look at our
school singing
agenda.
that song.
Let's go look at it again. I got